Hello, good morning or good day. We are in Kazakhstan, in Astana right now, and we would like to take an interview with the sonographer, the ultrasound diagnostics physician. Her name is Dr. Rimma Bekenova, and we will talk about the chronic pelvic pain and pelvic venous disorders, pelvic congestion syndrome in particular. Good morning, good afternoon, Dr. Rimma. It's really nice to be here with you. Thank you.
Thank you. Good morning. I would like to say that ultrasound doctors practically primary link to detecting varicose vein in pelvis. Because women came to ultrasound doctors because they have pain or discomfort in that area. So ultrasound doctors can detect the varicose vein in pelvis, examining the uterus itself. It's around uterus, around the bladder, urethra, and so on. We using the additional functions of the ultrasound machine. There are pulsative and color Doppler, and we use additional functional probe like Valsalva probe. And if we say the causes of the varicose vein in pelvis, one of the reasons can be compressed left renal vein. It's a nutcracker syndrome. But we can't see it always. And next reason can be Turner syndrome, compressed iliac vein, but it's not so a requirement from ultrasound doctors to see the reasons of this syndrome. We just need to see, detect the dilated and deformed vein in pelvis. And sometimes dilated vein, we can see that on external genitalia, sometimes on the legs, especially when we see the pregnant women.
Dr. Rimma, thank you so much. I know that you follow the protocols which are being published in the literature, the up-to-date protocols. Basically, you can see the protocols on our webpage, and now we will look into the examples of the ultrasound recordings that you've collected with your comments.
While we examine the pelvis, we can see dilated vein on the uterus itself, and of course a dilated and deformed vein around the uterus, urethra, rectum, and others. We use color Doppler, and we see how much they're dilated and deformed. And on ultrasound, we try to check if there's nutcracker syndrome. Here I tried to see left renal vein, and there no nutcracker syndrome. And here is I check internal iliac vein if there are any reflux, and you can see that there are no any reflux. But anyway, the patient suffered from the varicose vein of pelvis, and here is a thrombosis in the part of the dilated vein, and sometimes we see thrombosis in the vein. And sometimes dilated vein seems to be like tumor because they're too dilated. When we use color Doppler, we see that it's not the tumor, it's dilated vein. And here is a pubic vein, they're so dilated. We use another transducer, and here is a reflux in the perforative vein.
Thank you so much. Again, this was really educative and helping us to highlight some details of this diagnostics procedure. And as we see, the ultrasound diagnosis is the perhaps first level and easy accessible and easy to use method of the differential diagnosis. But after ultrasound, there's always should be further examinations, including venography and angiography if necessary, to confirm the diagnosis. But we want to help you get more information about this pathology, diagnosis, treatment options, and all around that. Thank you so much, Dr. Rimma, for your time.
Thank you.